Dr. Gastroenterologist. Today I want to talk about gallstone. Someone asked me, I was incidentally found to have gallstones. What should I do about that? Actually, there are many treatment guidelines, there are many expert opinion. I will follow this what we call AAFP guideline that stands for American Family Physicians guideline, AAFP. So the guideline basically say first, gallstone is very common. Roughly 10% of the general population have gallstone. Number two, most gallstones do not cause problem. An estimated 1 to 2% of people with gallstone every year will have problem. Accumulatively, maybe 10 to 20% of people with gallstone will ever have problem. Like, what can gallstone cause? They can cause gallbladder infection when the stone block the opening of the gallbladder. They can cause bile duct obstruction when they block the bile duct, or they can cause acute pancreatitis when they block the pancreatic duct opening. So gallstone can cause complication in the gallbladder, bile duct, or the pancreas. The chance or the risk of that happening every year, if you have gallstone, is estimated to be 1 to 2%. So how do we treat gallstone? There are medicines we can take to dissolve the gallstone, but it takes a long time, years to dissolve the gallstone. And when we stop the medication, gallstone may reform. For that matter, we don't normally give them this dissolution therapy because it takes a few years to work, and when you stop it, it will come back. If the gallstone cause problem, we do a surgery called cholecystectomy to take out the gallbladder. Nowadays, it is a very safe procedure. We can do it through keyhole surgery, minimally invasive surgery to take out the gallbladder with the stones. But the surgery still carry a risk, usually less than 0.5% of serious complication among people. So we do an analysis. If we leave the gallstone behind, the risk of complication 1 to 2% per year. If you just take out the gallbladder stone, then there's up to 0.5% risk of severe complication. So it will be logical to wait till you have complication, then we take out the gallstone. If we have no complication, taking out the gallstone, we subject you to risk of a surgery. And for all you know, you may be one of those that go to heaven with a gallstone. So most experts, including the American Family Physician, say if a gallstone cause problem like pain or infection, then you take out the gallbladder and the gallstone. If the gallstone are not causing any problem, what we call asymptomatic gallstone, then doing a surgery may impose a small risk that are not necessary. So, but there's some caveat. If you live in Singapore, very easy. You have pain, you go to the hospital, you have a gallstone complication, you'll be attended to very promptly. But you live in, say, Bali, Bintan, in the island, big area, there's no immediate surgical expertise that to see doctor, you take a ferry or take a plane to somewhere else, then may be different. Or if you live in the countryside, in order to have a gallbladder treated when you have a complication, you may have to travel tens of miles before you reach a destination. Then you may want to take out the gallstone, but discuss with the doctor. To sum up, if you have gallstone, it's not causing a problem, we do not recommend you taking out the gallbladder and the gallstone. One more thing, can you just take the medicine to dissolve the gallstone? Yes, there is such a treatment, but it may cause some digestive complication, and it's not cheap, and when you stop the treatment, it will come back, so we don't recommend. Or can you do a surgery to take out just the gallstone? You can't, because when you open the gallbladder, take out the stone, you stitch it back, the scar itself will form more gallstone, so we don't recommend that. To sum up, if you have a gallstone, pick up because you do a health screening, I would suggest leave it alone unless under special circumstance. This is Dr. Desmond Wang.